I would like to start my presentation with a quote of a Greek philosopher who said, first of all, you have to clearly define your goal, your ideal. Secondly, you have to ensure essential resources and methods. And thirdly, focus all resources on achievement of your goals. So even ancient Greeks noticed that you need to clearly identify your goals, that you need to have resources and adequately use them. So let's focus on modern times. The UK PM Winston Churchill said, no matter how great is your strategy, you should also look forward to results. So you need to check if your strategic assumptions are working and adjust your assumptions if required, because the strategy is not constant in time. It can be adapted if deliverables are not achieved. Well, we are talking about long-term planning, about long-term strategy for eHealth. So we need to define what we understand as eHealth. Is it telemedicine? Because sometimes those terms are used as synonyms. So I have adopted definition of the European Commission. eHealth is application of tools and services of information technology and communication technology in healthcare. So technology and everything related to health services plus healthcare. This is eHealth. Telemedicine, telecom, telematics in healthcare, medical information and communication technologies in medicine. So there are two sides to eHealth. Patients, because without patients, there is eHealth is pointless. If they are not going to use those solutions, why bother to design state-of-the-art solutions? What are the benefits for the patient? Well, greater availability to healthcare, for example, mountains, rural areas where medical services are not readily available. Lead time is much shorter. Better access to health information, for example, to your own health records stored in digital format, or no overlapping of the same tests because you have access to previous results. What about health establishments? There are also certain benefits for them. Speed of data transfer between healthcare professionals, between different healthcare institutions. We can reduce treatment costs, administrative expenses. The quality of medical services is going up. We are not eliminating entirely, but we are mitigating the number of medical errors because human perception is limited. We get tired, we commit mistakes, and then a tried and tested safe system is resilient to errors. Effectiveness goes up because we have better resources and we are eliminating red tape. Right now, I would like to focus on the patient's perspective. I would like to quote a Biostat report from 2019, Telemedicine in Perception of Poles. There are several interesting figures presented in the report. A minor percentage, just 18% of Poles understand what telemedicine is. 50% of respondents have heard this term before on television or elsewhere, but unable to define it. And 33% have never heard it before. What is important? Enabling factors for telemedical services. They can be endorsed by my physician, by my clinic, by my outpatients clinic. So this shows us how to promote e-health strategy in terms of education. What makes me very happy, people who have benefited from telemedicine, 40% are keen to continue using it. So this is an uplifting information, but 70% of respondents paid for those services out of their pockets. 30% of services have been reimbursed by the Polish Health Fund. A PW report from 2016, which covers the years 2014-2016, but 25% of visits or appointments, remote appointments, were video conferences. And the Polish National Health Fund and the Ministry of Health in August this year conducted patient satisfaction survey, and it revealed that only 30% of patients had video conferences. All the rest had a telephone conversation with the physician, what is highly worrying. We were trying to get to root causes of the problem, but the entry barrier is technology. And as a result, it's much easier to grab your phone, talk to the patient, and have video conferences. Okay, conclusions. Telemedicine seen by the patient. We should be educating patients, build their awareness, show them capabilities and opportunities. We should also support healthcare professionals in terms of education. So we have reached out all universities with an offer. We are able to provide them with access to software, with curriculum to get used students to telemedical tools, so they can learn the ropes and benefit from new solutions. And telemedicine should be funded from the public budget. While planning the strategy for eHealth, we have to face certain technology challenges. A report of the Central Statistical Office of Poland from 2019 reveals that more than 80% of households in Poland had a computer in 2018, and more than 80% had internet access. So figures are high, but if you want to apply eHealth universally all across the country, this figure should stand at least 90%. So in 5G strategy for Poland, the ministry has noted that its 5G network, which is being launched in Poland, will be offering brand new possibilities in healthcare, especially for analytics, imagining. You will be able to transfer major data sets over the network. The Internet of Medical Things will be also offering brand new possibilities. Wearables, for example, will do the same, or monitoring equipment that is sending measurements over the network to a platform. There are many inquiries we are getting about platforms where those devices can be connected to. And there are also medical functions which are critical, and they usually call for very swift reaction, up to 5 seconds, and 5G network will certainly enable that. AI, I know that it's a topic for a whole different presentation, but it will support the patient in analyzing symptoms. It will indicate risk factors in case of severe and chronic diseases. It will support medical professionals in analyzing major data sets. It will support decision-making process. It will analyze medical data on whole populations, predict changes in the healthcare status of the population to create the so-called health maps. So, for example, CardioVest, how does it work? It works 24 hours a day. The signal is sent to our platform, CMAP. AI detects irregularities, and later records are sent to the monitoring sector, where they are evaluated by a physician. And right now, I would like to comment on a document from May 2018 drafted by Telemedical Working Group, represented by other panelists. On the central level, what is still missing is the strategy for development of e-health in Poland. As far as I know, this document has not been issued. It should be drafted by 2013. We have pilot programs for P1 platform. Hopefully, it will be up and running soon. We want it to be open for external providers. New data can be fed into the platform, but it would be good if patient or certified apps could share data with the platform. So this would give the patient access to his or her medical records via his phone. Standardization of electronic medical records, e-prescription, e-sick leave, e-referral should be shared over the platform. Further development of functionalities in line with the identified roadmap. Development is not happening as fast as it should be. There are several regional platforms. We had the pleasure to design Podlaskie Zdrowie and Wielkopolskie Zdrowie, so two regional platforms, but there is no legal framework in place. We need guidelines to build platforms because these are standalone platforms which have no interoperability. They have very different functionalities. They should be interoperable with P1 platforms. We need to have a clear split of responsibilities, and we need to support entities that are operating local platforms because their use is insufficient. And to sum up, assumptions of our long-term strategy: education of patients and healthcare professionals, persistent increase of funding, of public funding on e-health, development of broadband IT networks, including 5G, privately and publicly, we should be investing in research projects related to AI, ML development and sharing central tools supporting the ultimate treatment process. We should structure the approach to electronic platforms and make the most of synergies, because commercial and public platforms working together are able to create a system that will become a blueprint globally. And we believe that it should be a revolution, but introduced in evolutionary way.